Now I have to tell you about the inguinal ligament. You know inguinal ligament, what we have studied it is attached on the anterior square like spine on the lateral side and medially on the pubic tubercle. This is the pubic tubercle, I have kept the bone, and this is the anterior square like spine. So it is extending from here to here like this. So this is the inguinal ligament. This inguinal ligament is inclined at an angle of 35 to 40 degree with the horizon. This is the horizon. So with this angle is 35 to 40 degree, right? Now external oblique fibers, they are coming like this. In the lateral aspect, they are making an angle of 10 to 15 degree to the line of inguinal ligament. This is the inguinal ligament. So the fibers will be coming over here, and this angle between my index finger, this one, and the inguinal ligament, that is the forceps, that will be 10 to 15 degree. As they go towards the medial side of this, they will be parallel to it, and they will be then rolling like this to form the inguinal ligament. So inguinal ligament is between anterior square lag spine and the pubic tubercle, and the midpoint of these 2 points, that is anterior square lag spine and the pubic tubercle, will be called midpoint of the inguinal ligament. Remember that this is the midpoint of the inguinal ligament, and mid-inguinal point is between anterior square lag spine and the pubic symphysis. Okay. So this inguinal ligament, it has got other names also. It is also called Poupard's ligament. Poupart apostrophe S. Poupard's ligament. It is also called superficial crural arch. It is also called crural arch. So there are 4 names for this. Number 1, inguinal ligament. Number 2, Poupard's ligament. Number 3, crural arch, and number 4, the superficial crural arch, right? So that is about this inguinal ligament. Now it has got, this is the main inguinal ligament. It has got various extensions. One of its extension from here will be the reflected part of the inguinal ligament, which will be reflected like this. From pubic tubercle, it will be going upwards and medially towards the linea alba. One will be coming from this side, one will be coming from this side, and that is called the reflected part of inguinal ligament, and that will be present over here. Now, another part is the lacunar ligament, also called Gimbernaut's ligament. Gimbernaut, Gimbernaut's ligament or lacunar ligament, right? So what is that? So as these fibers are coming over here, they will be turning from here, they will be turning medially like this, right? So a triangular ligament will be formed over here, whose base is directed laterally, apex is attached at the pubic tubercle, and this posterior border is attached on the pecten pubis, anterior border is attached on the lacunar ligament. So if this forceps, say, is representing my lacunar ligament, this will be the, so forceps is representing the inguinal ligament, then this lacunar ligament will be oriented like this. Here is the lacunar ligament. This triangular ligament is the lacunar ligament. It has got an apex attached to the pubic tubercle. This border is attached on the inguinal ligament. This border is attached on the pecten pubis, and this is the lateral border, which is concave in shape, and this forms the medial boundary of what is present over here is the femoral ring or femoral canal, right? So its medial border will be formed by this, right? Now, this lacunar ligament is horizontal in orientation. The length of this from apex to base is 1.5 centimeter or 1 centimeter approximately. Then from the posterior border, this one is extended upwards in this direction to be attached over here. This extension over here is known as pectineal part or pectineal ligament, and this is also called pectineal ligament of Astley-Cooper. This extension is called pectineal ligament or ligament of Astley and Cooper, right? This is another extension. So if you get a note on the inguinal ligament, you have to describe this inguinal ligament, you have to tell about the lacunar ligament, you have to tell about the ligament of Astley-Cooper, and the reflected part, which will be going from here towards the opposite side. So these are the 4 parts of the inguinal ligament. This is what I have to tell you. Now another thing, in this aponeurosis of the external oblique, here is present one opening that is called superficial inguinal ring, also called the external inguinal ring or the superficial inguinal ring, through which the spermatic cord will be emerging. This is the spermatic cord which is emerging over here. We will be discussing about this in detail in the class of inguinal canal and in the demonstration of inguinal canal. I am not going to touch it here now, right? So inguinal ligament is part of the external oblique muscle. That's why I have taught you here. Anything else? Thank you.